As we get older, it's not uncommon for our joints to begin wearing out, and the most common complaint, you probably guessed it, is our knees, but some new techniques are a big win for patients. This is an important day for the Fern Creek Tigers. The baseball team is playing a critical district game, and their coach is getting them ready. But 2 years ago, he was sidelined with a knee problem.
And I was playing basketball, kind of had a traumatic injury. It dislocated my kneecap. Part of my cartilage kind of got seared off, and after that, it just, he said, I got this new technique, and he goes, we're going to give it a try, and I was all for it, and I knew I needed to get something because I didn't want to have a total knee eventually. So
he didn't have to have a total knee replacement. Joseph DeSensi had a unique procedure called Cartilage Regeneration, where cartilage from a juvenile donor was treated and placed in the damaged part of his knee. Dr. Akbar Nawab was his physician.
So in his situation, we used juvenile cartilage graft, inserted it into his defect, allowed that to mature, rehabbed him very specifically, and now fortunately 2.5 years later, he's really doing very well.
JD chose Dr. Nawab specifically because he had expertise in cartilage regeneration.
I was working in physical therapy at the time. My first knee injury, I knew of him, and I knew the great works he was doing. So another doctor recommended me to him, and I really got to know him through my first surgery. And he told me exactly. He explains everything just like you need to be explained to you.
Our hopes are that we will certainly delay that option. Knee replacement is certainly a part of orthopedics that will be a necessity for those patients that are too far progressed. But if we can acknowledge the injury, recognize the injury, and then treat it in a very time-efficient fashion, we may be able to change that natural history.
As for JD, after 2 years, he is healed and back in action.
I'm great, 100%. I never would have thought that I could be back to playing sports, coaching. I'm running around with high school kids, which is amazing, and it was probably the best thing I've ever done. I didn't know at the time I was in so much pain and swelling, and it was just amazing.
Dr. Nawab says don't wait until you're in unrelenting pain to get checked out. At the first sign of trouble, talk to your doctors. The earlier it's treated, the better the outcome. For Norton Healthcare, I'm Jackie Hayes.